When it comes to cultural factors for those who have been sexual assault victims, minority women or any sexual assault victims are found to actually disclose lower rates of assault. Um, this is actually because of cultural stereotypes which discourage any minorities from seeking legal and medical help, and a lot of stereotypes that perpetuate within the cultures themselves. So that way, there's still a lot of victim shaming, and they don't seek the help that they should. So there's a rather large disparity in assault cases that happen and those that are reported. Another concern that arises from this is the mental health outcomes for those victims of sexual assault. It's found that Black women seem to indicate a higher prevalence of PTSD symptoms, while Latinas indicate higher anxiety and higher rates of psychiatric hospitalization. One thing that's concerning about this and cultural factors is if a minority tries to enroll in a type of program or a type of treatment and they find that they are not of the same ethnicity as the provider, they often don't complete the enrollment or don't finish the treatment due to the differences in the cultural factors. So this is important to consider, especially when it comes to suicide risks, because these assaults do happen to minorities at an extremely high rate. Actually, Native Americans are at the greatest risk. However, across all minorities, it happens pretty regularly, unfortunately. Something ironic I was unable to find actually was even a graphic illustrating minority sexual assault cases. So anything I found was really mostly focused on, the race of the perpetrator, just if it happened on a college campus, etc., etc. So nothing focusing on minorities and the cultural factors that might actually keep them from reporting and getting help for their assaults.